Go.
Hey everybody, thank you so much for joining us. I'm so sorry that we can't be together for the Texas Bleeding Disorder Conference. Normally this would be live, but today we are going to have to emphasize the importance of self-infusion in a virtual setting. So my name is Desiree. I'm the nurse coordinator at the South Texas Hemophilia Treatment Center, and this is my son Zachary, and he has been so kind to volunteer to do a self-infusion class. He does not have hemophilia, but has been to lots of educational programs. And so today, I'm actually going to show him how to self-infuse onto our dummy arm today. All right, so first of all, thank you so much, Zachary, for helping us out. First of all, before we get started, we need to wash our hands, and we are in the virtual world, so we are gonna go ahead and use some hand sanitizer. I'm actually gonna take my rings off so I can wash my hands too. And so we have to rub really, really good. We would wear masks, but we live in the same house, so we are not required to wear masks when we're with our family, our little small family here. So we're just gonna clean, and we wanna make sure our hands stay moist for about 30 seconds. And then while I'm getting all the supplies ready, Zachary's actually going to go ahead and drink water. What does water do, Zach?
It gets your veins juicy.
That's right. So he's gonna go ahead and get some water down while I get all the supplies ready to go ahead and show him self-infusion. So first of all, I'm gonna go ahead and get all of my supplies because I'm gonna show him how to do it first, and then he's gonna go ahead and demonstrate it after I show him how to do it and see how he does. And this is his first time self-infusion. So this is kind of what we do when we're at hemophilia camp where I'm teaching the 7-year-olds. Luckily, he happens to be 10, so he's watched me do this quite a bit of times. So, without further ado, we're going to start talking about, how's that water coming? Pretty good? Okay, I think that's good. Let's put that lid back on so we don't spill it. All right, so a couple of things. First of all, the things that we need to self-infuse first of all, we need the tourniquet, and then we've got the butterfly, and it doesn't really matter. Sometimes you guys like the green, the blue, and the orange. We've got the alcohol, gauze, Band-Aids, and because we don't have factor products here, for our self-infusion class today, we're gonna actually use saline, but we're gonna pretend that this is our factor. Okay, so I'm gonna get everything ready, and today Zach is gonna be quizzed on everything. We went over some of the procedures, and so we're gonna go ahead and get started. So first of all, Zach, what are some of the things that we need to be able to self-infuse? What is this? Tourniquet.
Tourniquet.
That's right. What does the tourniquet do?
Gets your veins pumping.
That's right. So, and then the second thing, what do we need?
A butterfly needle.
A butterfly needle. That's right. What's the next thing?
What is that? Gauze.
Gauze. That's right. And what does the gauze do?
Stop the bleeding.
That's right. And then what else?
Alcohol.
What does the alcohol do?
Cleans the spot where you're gonna self-infuse.
And then what else does it do? Cleans on the top of the factor when we're opening up the factor. That's tricky because we don't have factor with us. And then last but not least is what else?
A Band-Aid.
A Band-Aid. All right. Perfect. And then sometimes kids like to use, or adults like to use the squeegee, so that way once the tourniquet goes on, we can squeeze it and we can pump those veins really, really good. So right now we're just going to show you that. We're not going to necessarily use it this time. So I'm going to get everything ready to go. So first of all, I've got my tourniquet. But the first thing before we get started is we want to go ahead and go over the butterfly. And this is actually the first time Zach's ever really played with the butterfly, is it? Or we played it with some of our classes?
No, I've never played
Okay.
with them before.
Good answer. All right. But today we're going to actually play with butterflies. And so we're going to go over the different parts of the butterfly. So when it comes out like this. And it's all, you see how it's just kind of, it's not straight line. So what we want to do is we want to kind of hold it up here right in the butterfly area. And we want to straighten that line out. And the reason why we straighten that line out is we want to make sure when we go to infuse that it's not all tangled up, and so it's less likely for the needle to come out of the vein. Okay, so we've got all of that ready. So we're going to kind of talk about the parts of the butterfly. This is really important because most of the time, if the butterfly does not go into the vein appropriately, then we might have to actually take the needle out and then redo it, and then we don't want to have to stick more than once. So we're going to start out with the actual needle itself. And I know it's hard to see, but on the butterfly, there's actually a hole in the tip top. Do you see the hole in the tip top right up here?
Yes.
Yes. Do you know what that is called?
No.
That is called the bevel. And it's really important because when you go to self-infuse, you want to make sure the bevel or the hole is always up. Because when you go to infuse and you stick that vein, as soon as that blood hits the end of the bevel or the hole, that's where you'll see that blood return. And everybody's pretty familiar with the blood return. So we want to make sure we get in there. If you have it upside down where the hole is not, you're not necessarily going to get that blood return, and you may end up having to take the needle out and redo it. So the top of it is the bevel. Then you've got the butterfly wings. Some people like to hold the butterfly wings like this. Some people like to put their finger down like this, and they kind of infuse it like this, where they kind of slide it in with their finger underneath here, which actually underneath here, and have it where you're able to slide it in, okay? Then you have your tubing. The tubing is what your medicine goes in. And so at the very end, there is a cap that we'll take out, and that's where you actually put the syringe, and we'll go ahead and connect those shortly. Okay? Zach, you have any questions?
Yes. Which way are you supposed to infuse the butterfly needle?
That is a great question. So the way that you always think about this, the way that you always remember is that the needle has to go toward the heart. So Zach, let me see your arm. So if we have, let's say we want your rockstar vein, that's what we always tell our little guys, rockstar vein is right here. If you were having to put the needle here, which way would you hold that needle to stick it in?
Up this way.
Why would it be going up that way?
To go to my heart.
That's right. So anytime that you have that needle, it always goes up and it goes where it goes into the heart. Okay? Good job. All right, so let's go ahead and get started. So what I'm going to do right now is I'm going to prime this butterfly. And priming it, all it means is that we are going to take our pretend factor and we're going to open this up. And remember, this is just saline, which is just salt water. So we're going to make sure that we take all the little bubbles out and put it up just like that till the tip top. Now, never touch the tip top of the saline syringe or the factor syringe. And when you unscrew here, you never touch the bottom here. Do you know why, Zach?
No.
Because you don't want to put germs or bugs on the end of here or germs on the end of there, because this needle is actually going into your vein. And so you want to make sure it is clean as possible. So you make sure you have that snug. And then the next thing you do, Zach, is we're going to go ahead and push the factor through the line all the way to the tip top. So I want you to watch this, and I want you to tell me when it gets to the very tip top. You ready?
Mm-hmm.
Now, if you push it really fast, guess what's going to happen?
Oh.
Exactly. It's going to spray all over you. So you push it real slow all the way to the tip top. You see that one?
Yes, I do.
Okay. So we are completely primed and ready to go. Zach's a little wet, but he'll be okay. Okay. And we don't want to do that with real factor, because that you want to make sure you get your full dose. But we just use that as an example to make sure that you push it in fast enough, but not too fast because you don't want it too wet. All right. So we've got our tourniquet. And then we've got our gauze, we've got our alcohol wipes, and we also have our Band-Aid. So we're just gonna get everything ready. And I assume most of you have had infusions of factor, but if you don't, we're just gonna kind of go through the review, and then I'm gonna show Zach how to do it, and then he's gonna demonstrate, okay? And if you have any further questions after this demonstration, you can reach out to your Hemophilia Treatment Center, and they would be able to provide classes. Or you can reach out to your chapter and set up some classes. We are more than happy to do something like this, a virtual setting, if we want to do that. Okay, so first of all, Zach, good job drinking that water. First of all, we're going to go ahead and use our tourniquet. We're going to put the tourniquet, because I've been looking at these veins, and there's really good veins, and I think my favorite Rockstar vein is probably right around here. So if we're going to use this vein right here, I'm going to put the tourniquet right about here. So that way it's just tight enough into this area. We always like to use these tourniquets because they're softer. Okay, so we're just going to put the tourniquet on just like this. We want to make sure that when we put the tourniquet on, that we can still push that button. Make sure the button is right where you can see it, and we're right here. And so what we're going to do is we're going to make sure we put the tourniquet on tight enough, and then we get everything ready. So first of all, we're going to start out with what?
Alcohol pad.
That's right. So we're going to clean, make sure we get all those bugs off, and clean, clean, clean. And I always like to kind of feel, and that vein looks really good right there. Do you see that one, Zach? Right there?
Yep.
It looks great. So we're just going to clean it. Then we like to air dry it. We want to always air dry it. You don't want to blow on it because you don't want to have the bugs from your mouth into your vein, okay? So we'll let that dry a little bit. And I always just, when I'm drying, I just kind of keep an eye on it. The other things I like to do is just wipe the alcohol on my tips of my fingers because I always like to feel. The key thing with veins is you always go by feel, never go by sight. You always make sure you can feel that vein. So that way, whenever you're going to stick it, the best veins are the deeper veins, the ones that you can feel. Okay? All right, so we've got everything ready. The technique to do the butterfly, my favorite way to do it is I actually fold the butterflies up like this, so you're holding it just like this. And then what we like to do is I take my other finger and I feel that vein. And what you like to do is you'll take it and it's like landing an airplane. You never go like this. You never go just slide in. You always kind of land it like you're landing an airplane. Okay? So you're gonna feel it and then you're gonna go 3, 2, 1 in. And then one of the things you'll make sure that that hole is up, the bevel is up, and then you push it in until you get a slight bit of blood return, in which we have a little bit in that line. And you always pull back first and make sure you get blood all the way in that line. And if you get blood, then you pop your tourniquet, because if you forget to pop the tourniquet, what'll happen is you may end up making that a bubble on top of it because the medicine has nowhere to go. So then the next thing we're gonna do is we definitely have good blood return. And then the next thing we do is we slowly push this medicine into the vein. And you always watch when you're pushing that into the vein that nothing bubbles up and it's slowly pushing in and you've got good pushing. If you have any problems with that, let's say if you push and then all of a sudden you're like, I don't know if it's still in, you can always pull it back and make sure you've got blood that's still in that vein. If you still have blood in the vein, or still have blood in the line, you're still in the vein. So then you continue to go ahead and slowly push that factor in there. Now, one of the things that I will tell you is that if you lose that vein, sometimes, depending on how old the child is, or if it's an adult, we do a lot of adults, if you're able to put back, if you're pushing and it's not doing what you want it to do, you can always put the tourniquet back on just a little bit longer and either have the patient kind of squeeze his hand a couple of times and then you can re-feel it. If you lose the vein completely, the best thing for you to do is to go ahead and slide that needle out and start over. Now, we are pretending, because we're using saline, that we pushed it all in, and as soon as you push it all in, normally it's about 3 to 5 minutes, but I always tell my patients if it's a moving target, you just try to get in there as quickly as possible without blowing that vein. And so your next step is you'll put the gauze on top of there and you'll count 3, 2, 1, slide it out, and that's how you infuse. Okay? How do you feel about that?
Good.
You ready to try it?
Yeah.
You think you got this?
Mm-hmm.
Okay. All right. Let's get all of your supplies ready. Okay. Oh, the last thing I forgot was our Band-Aid. But of course, this isn't a real arm, so we'll just pretend that we just held some gauze on there for a little while. Okay? All right, Zach, let me move all my trash out of the way. Remind me, what are the things that we need to infuse?
Butterfly needle.
Butterfly needle.
Alcohol wipes.
Alcohol wipes. Yep. You got the alcohol.
Gauze.
Gauze. That's right.
A Band-Aid and what is this called again?
A tourniquet.
Tourniquet.
That's right. Okay. So Zach, we're gonna go ahead and start getting things ready. But before, we always have to pretend. Let's wash our hands. We're gonna wash our hands again.
For 20 seconds.
Between each time that you infuse, or even time before and after, always wash your hands because you just never know. Okay. All right, let's get this started. Now I'm gonna show you exactly what to do. This is the part where you just don't get nervous, and if you have questions, we'll go over this together, okay?
Mm-hmm.
So we're gonna open up the butterfly. What was the first thing I told you to do after you pulled the butterfly out? Do you remember?
Straighten the line.
Straighten the line. So let's go ahead and straighten the line. Hold it right here. You can just hold it right here. That's perfect. And then straighten that line. Put a little friction in there. Pull it down just like that. Perfect. Do it one more time. Kind of heats that up. Perfect. And then you're gonna take this. You're gonna put the needle back into this little area.
Like the needle?
Yep, just like that. Now, we wanna go ahead and prime the line. Don't take that off yet. That's okay. So we're gonna take this off, and I want you to slowly, remember what happens when you push it fast?
It goes out of control.
So just, yep, you can just slowly push it up there. There you go. Now that's ready to go. Now hold this with one hand, or you can actually, I'll hold it for you. I'll be your assistant. And you're gonna go ahead and untwist that, Now, what are you not ever supposed to do? Touch the top.
Oh yeah.
Go touch the tip top here and
this tip top.
why?
Because you can get germs and bugs on it.
You can get germs and bugs on it. That's right. So what are you going to do? You take these and you're going to twist those together. Come on. There you go. Perfect. Oh, there you go. Superman it. Now, you saw that we had a bubble in there. What we're going to do is we're going to slowly take that bubble out. And it happens. There we go. We're going to twist it right back on there. Just like that. Okay? Okay. So then you're gonna take this, hold this like this, hold this right this, and slowly push that and look at the tip top here.
Okay.
And go ahead and prime. Oh, there you go.
That was really fast.
Yep. And go ahead and put the needle back here. Okay. All right. So we're gonna pretend that this is your arm. We're gonna take that tourniquet and what are we gonna do?
Put it on the arm.
We're gonna put it on the arm. So let's put that back on the arm. Now, what do we always have to make sure you can always touch?
The vein. Oh, you can always touch the button.
That's right. You want to always touch the button. Okay. We're going to stick that on there just like that. Oh, you got to tighten it up. Superman that. Do it a little bit tighter. There we go. Okay. Now, Zach, I want you to look at all these veins and I want you to tell me what is the best vein.
I think this is the rocks.
Just remember, you have to be able to do it where it's comfortable. We can always move the arm that's best.
Right here.
You want to do that right there?
Yep.
Okay, so if you're going to do this vein right here, how should your arm be? Because remember, which way does the needle point?
This way.
That's right. Okay, so we want to make it where it's comfortable for you. Are you able, what are you, right or left-handed?
Right.
Okay, so you're going to use the needle right here. So let's pretend you have the needle in your hand. And which way? So you might want to get over here, just like that. Are we still in the picture? All right. Perfect. And then, no worries, it's okay. And so the next thing that you're going to do is you're going to pretend 3, 2, 1, slide it in, slide it in. What are we looking for? What are we looking for? Flashback.
Oh, the bubble.
The flashback. You want to see if you can have blood in the tube.
Oh yeah, the blood.
And then you slowly what? Draw back. You want to draw that back. Make sure that there's more blood in the tube. And then what's the next step?
Push the.
Nope.
Oh, take off
the tourniquet. That's right. So go ahead and pop that. Excellent. And then we'll draw back, and then you slowly do what?
Put the factor in.
Okay. All right. You ready? Put that back on. Now that we pretended, now it's the real deal. This is the ultimate test, guys. Here we go, Zach. You got it? Okay. All right.
Okay.
Say, hey, Junior, pump your hand. Pump your hand. Pump your hand.
Pump your hand, Junior.
All right. He's pumping his hand. Okay. Excellent. So what's the next step?
Alcohol.
You got to clean what?
The surface.
Clean those bugs off there. There you go. Clean it off real good.
Make sure to let it air dry too.
And never to blow on it, right?
Blow on it.
Don't blow on it. Okay. Good. We're going to let it air dry just for a minute. And remember, you're going to keep it right there and you're going to wipe your little fingers. Wipe your little fingers. Right. Because if you have to feel the vein, you want your fingers to be wet. There you go. We're going to leave that right there.
Yeah, that's a rock star vein.
Rock star vein. Okay. Next step, go ahead and take that sheath off of there. Be careful not to poke yourself. And then you put the little butterfly wings up like that. Where's the hole? Where did you see the hole on the butterfly?
Yep.
Okay. Never touch that needle. You ready?
It's really sharp.
Yep. And so remember, when we go in, we're going to guide you just like we're going to land an airplane. Okay? And you're going to go in. 3, 2, 1, slide in. Ooh, now look at your line. Do you have blood return? You've got,
yes.
we've got blood return. What's the next step? Slowly let go of the needle. Okay. Get your, draw back. Nope, draw back. Draw it back. Not push, draw back. Do we have blood all in that line?
Yes.
What's the next step?
Push it in.
Nope, what's the next step?
Take off the.
Pop the tourniquet, that's right. Perfect, and be real careful. And then we're gonna pretend we're gonna slowly push that in, but we're really not. Just because it's a fake arm this time. Slowly push it in. Oh, it's hard to push in. What do we do? Now when it's hard to push in.
You redo it?
Nope, draw back, make sure you're in the vein. Oh, great blood return. So what's the next step? We're gonna keep doing what? But you wanna make sure you're gonna use both of your hands. That's why you have both of your hands here.
Okay.
So you're gonna slowly you're gonna pretend we're gonna push that in. Push it in, push it in. Come on, push it in. We're gonna pretend to push it in. There you go. And then we're gonna pretend that we're pushing all of that in. Oh, good job, excellent. All right, and we get down to the very end, and what's the next step? What do we need?
We need the
The gauze.
The gauze.
Perfect. And where are you going to put that?
Right here.
That's right. You're going to do that with one hand, and then you're going to slowly slide it out with the other. 3, 2, 1. Slide it out. Excellent.
And then you take the
Nope.
Oh.
Yes. We just put the guard on. So he's got the guard on. And then what's the next step? You got to hold pressure. He's bleeding. All right, hold pressure. And what are we going to do next? Keep holding it.
Put the Band-Aid on.
Perfect. We're going to open up the Band-Aid. And we're going to put the Band-Aid on just like this. And some people bleed a little bit longer than others. So depending on how long, sometimes you can hold it for about a minute or so. Some people need a little bit longer. Okay. What questions did you have?
I don't have any questions.
He has no questions. Excellent. All right. Well, thank you guys so very much. And I'm sorry that we couldn't be together tonight, but I hope you guys really enjoyed this session of learning how to self-infuse. And if you have any questions, please reach out to your Hemophilia Treatment Center or reach out to the chapter and may set up some of these virtual programs for you guys. So once again, thank you for hanging out with us and then hanging out with Zach. And I really appreciate it. Thank you so much for your time.